tobacco, marijuana, and alcohol, three substances that are increasingly widespread and consumed all over the world, especially in adolescents. Epidemiological studies suggest that at least two of these three substances are often consumed together, thus increasing the risk of getting sick. The scientific literature is full of studies documenting the short and long-term effects of tobacco and alcohol, while we still know little about marijuana. This is because it has been studied for a short time, and consequently there are not many studies available, and often they have shown conflicting results. Let's briefly know the three substances we're talking about. Nicotiana tabacum is a short-leaved perennial plant originally found in North and South America. By drying the leaves of this plant, tobacco is obtained, which contains nicotine, alkaloid of vegetable origin and psychoactive substance, capable of inducing tolerance, addiction, and dependence. Ethyl alcohol, or ethanol, is a colorless liquid with a slightly sweet taste at the base of all alcoholic beverages, in variable percentages that determine the alcohol content. It is formed following the alcoholic fermentation of the sugars contained in the must, liquid obtained from the pressing of grapes. Alcohol is a toxic substance, potentially carcinogenic and capable of inducing tolerance, addiction, and dependence. Cannabis or hemp indicates a genus of plants with an annual cycle. One of the most widespread species in the West is Cannabis sativa, and marijuana is obtained from its dried female inflorescences. One of its major active ingredients is delta-9-tetrahydrocannabinol, also known as THC, a chemical substance with psychotropic action, i.e. capable of altering the psychophysical state of the subject who consumes it, and capable of inducing addiction and tolerance. Dependence. In the collective imagination, we associate the word drug only with heroin and cocaine. Wrong. The World Health Organization classifies alcohol and nicotine as legally lethal drugs. The recent legislation establishes a ban on the sale and administration of alcoholic beverages and products containing tobacco to minors under the age of 18. Marijuana, on the other hand, is an illegal drug in many countries, for example in Italy. If the detention is for personal use, it does not constitute a crime, but is punished as an administrative offense. On the other hand, drug dealing is a crime that is punished with imprisonment, which can be up to 20 years, as well as with a fine of up to 260,000 euros. An article published in the English medical journal, The Lancet, compared the addiction of certain substances. The researchers divided the parameters into three categories, using a scale of 0 to 3 for physical, psychological addiction, and for pleasure, and then they made the average of the total. Let's look at the scores relative to the total average of the drugs analyzed: heroin, cocaine, nicotine, barbiturates, alcohol, benzodiazepines, amphetamines, cannabis, ecstasy. Studies show that the likelihood of developing physical and psychological addiction to cannabis is lower than alcohol and tobacco. However, this is not meant to argue that recreational marijuana use is as safe or healthy as total abstinence from it. If you want to know how marijuana works on the brain and what its effects are, I leave you the two videos I made above. Death. Tobacco smoke is the second leading cause of death worldwide and the first preventable cause of death. It causes 6 million deaths a year worldwide. Passive smoking, on the other hand, causes 1.2 million deaths every year. In the world, alcohol is responsible for over 3 million deaths every year due to alcohol-related diseases such as liver cirrhosis, cancer, heart attack, road or work accidents, and suicides. There have been no reported cases of fatal overdose from marijuana use to date. It is practically impossible to ingest such a quantity of delta-9-tetrahydrocannabinol, commonly called THC, that it can cause the death of the person who uses it. However, the question of any deaths that may have been caused by long-term use of marijuana is different. To date, we do not know these data, so it becomes difficult to compare them to deaths caused by tobacco and alcohol. Long-term effects. Tobacco increases the risk of heart and lung disease, asthma, bronchitis, heart attack, stroke, thrombosis, and lung cancer. It reduces male and female fertility, causes irreversible brain damage, premature skin aging, increases blood pressure, and constricts blood vessels. Alcohol damages the liver, favoring the onset of fatty liver, fibrosis, and liver cirrhosis. It destroys the pancreas, changes the structure of nerve tissue, decreases libido, and causes impotence and infertility. It increases the risk of oral and mouth cancer, as well as increases the risk of myocardial infarction and stroke. Not much research is available on the long-term risks of marijuana use. Some studies indicate among the possible effects of chronic cannabis use: increased heart rate and risk of heart disease, depression and mood disorders, memory problems due to an impairment of the processes involved in the formation of short-term memory, decreased concentration and organization of thinking, and a learning difficulty. A possible link has also been established between chronic marijuana use to a greater predisposition to psychosis, depressive states, and anxiety in some people. Cancer. The substances that develop during the combustion of the cigarette are carcinogenic, thus increasing the risk of many types of cancer, especially lung cancer. About 85%–90% of lung cancer deaths are due to tobacco use. The carcinogenic substances contained in smoke are a risk factor for the development of cancers of the oral cavity and throat, esophagus, pancreas, colon, bladder, and others. The International Agency for Research on Cancer has classified alcohol as a carcinogen since 1988. It has been placed in Group 1, i.e. where there is sufficient scientific evidence of their carcinogenicity in humans. Alcohol is involved in the development of certain cancers, including that of the mouth, pharynx, esophagus, larynx, breast, colon, liver, and pancreas. The smoke deriving from the combustion of cannabis develops toxic and carcinogenic substances, similar to those of tobacco smoke, therefore capable of damaging the respiratory system. Other methods of consuming cannabis, which do not involve combustion, such as vaporizers, would not appear to be associated with the risk of cancer. The fact that many people who smoke cannabis also smoke tobacco, or mix the two together, makes it even more difficult to study the relationship between cannabis and the onset of cancer. More research should be conducted to better understand the cancer risks associated with long-term cannabis smoking and exposure to passive smoking of cannabis. Final considerations. Many governments in Europe have favored more restrictive policies on illicit drugs than alcohol or tobacco, as they consider the abuse of illicit drugs to be more dangerous. But is it really so? From the data shown in this video, things appear to be a little different. However, it is always difficult to establish the harm potential of consuming one substance rather than another. A number of different factors come into play that affect the final health effects, such as gender, age, frequency of consumption, and amount consumed, as well as genetic factors. Society and the mass media often represent the consumption of alcohol as an acceptable habit. The devastating effects of alcohol are underestimated, because the idea is that a glass occasionally makes good blood. False. The studies to date are very clear. There is no recommended or safe amount of alcohol consumption for health. The zero risk for cancer is linked to abstaining from alcoholic beverages. Marijuana consumption appears to be less harmful than alcohol and tobacco, however. The studies available are few and with contrasting results. Furthermore, less harmful does not mean safe or even healthy, as many people in favor of legalizing cannabis argue. What is certain is that even alcohol and tobacco must be considered as real drugs, and unfortunately, this often does not happen. And what do you think of it instead? Let me know in the comments.